My primary care doctor was giving me a prescription and basically told me that this was the beginning of my end. My health would deteriorate at the rate I was going. I was pushing 275. That really hit home. A friend of mine at the orthodontist office told me about what she was doing and having gastric bypass surgery with Dr. Matin. I talked to my primary care doctor and asked if he would think this would be a good option for me, and he said yes.
One of the unique things about gastric bypass is the ability to change some of the metabolism. Metabolic changes that occur with gastric bypass really been kind of looked at very closely in the last 5 to 6 years, where there are significant changes in some of those metabolic issues with gastric bypass. The most common one that's in the news is diabetes, especially type 2 diabetes. Type 2 diabetes can be very quickly controlled with a gastric bypass. Kind of a unique situation. That's why sometimes you have to look at a person's medical condition and say, okay, you know, your diabetes is really more risky than your weight, and say maybe gastric bypass is a better operation for you than a gastric sleeve.
Speaking with Dr. Matin about the surgery, he recommended the gastric bypass surgery. He said I would be a great candidate. And he just overall made me feel very comfortable in that decision. And I knew he's got all the experience, he has all the education, so I trusted him recommending the gastric bypass surgery.
Joanne did really well, very good outcome. She chose her surgery based on her medical conditions. She spent a significant amount of time kind of going through the educational process with the dietitian and kind of learning throughout other patients' experiences what she was getting into. So her expectations have been great. She's doing very well.
I have lost 119 pounds after my gastric bypass surgery. It's been about a year and a half. I'm feeling great. I was stuck in a shell with my weight, and now I'm free. I'm happy and I love my life.